Deputy Minister of Defense and Military Veterans, Bantu Holomisa, says his department is in talks with Treasury regarding the refurbishment of the troubled One Military Hospital in Pretoria. Holomisa visited the facility as part of the government's ongoing efforts to restore it to its former state. Progressive Health Forum's Dr. Aslam Dasoo joins us now live to talk about this issue. Very good afternoon to you, Dr. Dasoo. Thanks very much for your time. The Deputy Minister may have gone there today, but what he came out, to tell us about the state of that hospital is neither new nor surprising.
Good afternoon, Vio. Thank you for inviting me. You're absolutely right. I think the only surprising thing is that anyone is surprised. I mean, if you think about it, the entire Department of Defense and our defense forces, you have the Navy, the infantry, the Army, the Air Force, all of them have been in the news repeatedly over the years regarding their decline in one way or another. The military health services are an important component of any active defense force, and it always has to be at its peak. And you wonder what kind of protection, medical protection, our soldiers have when they're deployed. We saw that they don't have any logistical support, and you can be certain that they do not have the kind of medivac and medical emergency care that one would expect in a defense force. I think this is a litany of degradation, and nothing in the Defense Department has been spared this for 20 years. And the problem doesn't really lie with the Defense Force personnel on the ground. No, not at all. It is in the management, which is either incompetent, it's corrupted, or it's inappropriate for the kind of responsibility it has. You can't blame the personnel any more than you can blame the health professionals in our public health system, who also experience this decrepitude, this degradation through the terrible management of the public health service. So this is not surprising. I think the Deputy Minister should take a deep breath in and accept. And he was there for a while. He should know this has been happening for the last 20 years. So no surprise, it's just another indictment of very poor governance.
You're talking about something that's been happening over the past 20 years, but hardly a year ago, when the Minister of Defense was asked about the state of the hospital following visits by other people, she actually said everything was fine.
Well, she would, wouldn't she? I mean, what is she going to say? We're stuck in a kind of Kafkaesque time warp here, where your political superstructure is conditioned to repeat the mantra, no, everything is fine. We can do this, and we will be doing that, and we make this promise and that promise, while the degradation continues unabated. Now, we have witnessed this, and we have said so. During just before the first elections, the democratic elections in 1994, I had the privilege of having taken care of President Mandela for some time, ever since his release. But I was visited by the SANDF at the time, together with the incoming liberation movement heads, to say the military is responsible for the president's health. This made perfect sense. That's the case around the world, just to collect all the records from me. And I was quite happy to hand all of that over, thinking our president will be well cared for. But if you will have noticed, since that time, every president and every senior leader in the political establishment have been using private health services, not the military health services, which should be their first port of call. These facilities were so well resourced, so well run when the democratic government took them over, like so many other assets in our country. So you would think this is ours now. We know who built it and we know the conditions under which it was built, but these are now the assets of the people, our national heritage. whether it's the defense force, the police, our education system, our health system, even our public health system had all the potential to be a world-class national health service. It's nothing of the sort under this management. So it's very clear that the failure of governance is such that it can't be fixed by the people in office now. That should be absolutely clear to everyone. We're a constitutional democracy. We have the electoral process that allows the people to express their will about the state of governance. But even our electoral system is rigged. We vote for a brand, a political brand. It's the party bosses who decide who will be your representative, whether it's in councils or in legislatures. How is that direct democracy? So clearly, because the center, as we can see, is not holding, the die is cast here. There's a one-way ticket now for this political establishment to find a way out. It can't solve the problem, so it must move out, and the people should share it out. We are, like I said, a constitutional democracy. We're a country of laws, and we are able to do that. If we can get over this electoral hurdle, then I think South Africans can take charge of their country again.
Interestingly, Minister A.N.G. Motshekga is not the only or the first minister to actually deny what people had seen with their own eyes. Before her, Minister Thandi Modise at some point was forced to apologize after it was found that she was actually untruthful when answering the questions that were put to her. It is, though, a slap in the face. I'm thinking of those soldiers who were brought from the DRC who had to rely on this hospital for their care, given what they went through on our behalf and on the instructions of their government, what they would have found upon their return from what was clearly a very traumatic and quite testing experience in the DRC.
Sure. I think there's an absolutely watertight case to put the minister in the dock around this, assertion. This minister, the previous ministers, about everything being fine. As I said, they are, politically conditioned to deflect and to hide things, and if necessary, to lie. Clearly, if she said a little while ago that this hospital is in good nick, she was lying to the country and to Parliament, but it's more important that she's lying to the country. That's the constituency that depends on services like that. Our army, our defense forces are reliant on it entirely. Our senior politicians should be reliant, but they have comfortably carved out their own health care and left everyone else to, suffer the depredations of the utterly useless management of both our public health system and of our defense force. This is nothing that we can just sweep under the carpet. And I think South Africans need to begin to realize that we are not trapped by this government. We shouldn't feel that way. We should indicate to them, our parliamentarians should develop some spine and hold these governing politicians to account. But they are mostly in cahoots with them. So I don't know that the political establishment will give us an answer to something like this or to the other ills of the country. I don't think it's fit for purpose. It's mediocre at best. And I think there's a case to be made. This is one more building block for making a very solid case for a new type of governance in our country.
Let's leave it there for today. Progressive Health Forum's Dr. Aslam Dasoo, on the back, of course, of that visit by the Defense and Military Veterans Deputy Minister Bantu Holomisa to one military hospital, which we are told is in a dire state, despite previous denials by Minister